Welcome, everybody, to Mission Financial Planners, little lunch and learn we're having. Over the next couple of weeks, we'll be doing a deep dive through Medicare, long-term care, estate planning, and tax planning, noon Central Time. So thank you for all those that are here. If you aren't able to make it or know of anybody that would like to attend or watch these workshops, we'll be posting them onto our YouTube page. And so go to youtube.com/Mission Financial Planners, and we'll be posting them there. Now, the reason why we're here is to talk a little bit about Medicare and shine some light on this very common but also very complex system. And we're really going to be focusing on three main things. What is Medicare? What does it really do for you? Two, understanding how and why it's really important when you enroll. And then third and finally, knowing what Medicare covers, doesn't, and making sure you're as prepared as possible for your upcoming retirement. So let's begin. What are the most basic of basics? What is Medicare? And it is a healthcare plan to take care of you when you are no longer of working age. Because when you're of working age, ideally your employer was taking care of you. But for retirees, Medicare is the first step. Now, Medicare is its own standalone program, but it's administered by the Social Security Administration. Now, everyone over 65 is eligible for Medicare, and this includes all US citizens and legal residents who have lived in the US continuously for at least 5 years. Now, some people under 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will really pertain to the first group, so people over the age of 65. Now, Medicare is divided into four parts. Part A, which covers the hospitalization costs. So for major illness or injury that sends you to the hospital, Part A covers. Part B covers the most traditional sense of medical expenses, such as doctor visits, procedures, diagnostic tests. And the bills for Part A and Part B are paid by Medicare. Now, Part C and D are where the private insurance companies come into play. Part C is an alternative way to get Medicare. And you can sign up for Medicare Advantage plans offered through a private insurer, or you can get services with Part A and Part B, and usually prescription drug coverage as well through that plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then that plan is responsible for managing and coordinating all of that care. Now, Part D is prescription drug coverage, and it is offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go on Medicare, you'll want to sign up for Part D, because if you go without drug coverage for very long, you'll face a penalty when you do enroll. And just because you sign up with one Part D plan doesn't mean you can't switch over the years, but you need to be enrolled initially. Now, this image shows two ways to have Medicare. If you go with original Medicare, you sign up for Parts A and Part B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage as optional, but it can be dangerous to go without drug coverage. So we are strongly recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of Medicare. In step 3, you decide if you want supplemental coverage. Again, Medicare shows that this is optional, but we think it's pretty important because Medicare leaves too many gaps. Now, the second way to get Medicare is through Medicare Advantage plans offered by a private insurance company. And there are many companies in this area offering Medicare Advantage plans. So if you go this route, it'll be important to shop for plans and find that one that meets your needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. Choosing how you take Medicare is a big decision. It needs to be individualized, and we can go in depth. We can't go in depth today, but we can definitely talk through parts of it. Another tidbit is we'll see if we can attach a link to the YouTube page for this, but strongly encourage everybody to go to the Medicare website, and they have this document they publish every year called Medicare and You. It's like 80 pages, but it has all the different rules and everything you would want to know about Medicare. And this is really ultimately just a summary of that conversation. But and that's really basically a question of enrolling on time. And now let's get into the fundamentals of Medicare enrollment. So this is the main principle. Unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. 99 times out of 100, you need to enroll by age 65, unless you have explicit instructions from your HR department or your benefits coordinator to not. It's a safe assumption that you should do it at that time. Now, what if you don't enroll in Medicare on time? The consequences are pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it'll continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. And if you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, even if you have private insurance, you might get stuck with the whole bill. And then finally, your private insurance options may be limited. If you're in poor health or have pre-existing conditions, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get the insurance you want or need, or be charged an extra premium. Now, how do you enroll in Medicare? The most common way is through the Social Security website, or by calling in there. When you call into it, they're going to ask you, do you want to sign up for your Social Security? 65 is one of the more common ages to claim Social Security because just that. They call in trying to turn on their Medicare, and they're offered it, and they think, why not? Now, if you're still delaying your Social Security, you will need to be paying your Medicare effectively out of pocket from your checking or savings account. But once you fully enroll into Social Security, your Social Security will pick up that part of the tab. Now, when you sign up for Medicare, coverage is going to start the first month in which you turn 65. Now, Part C and D, as we've said before, are not automatic. If you want a Medicare Advantage plan, you'll want to contact the insurance company offering it and signing up for it in advance. Or if you want to stay with original Medicare and have a standalone Part D plan, you'll want to decide which insurance company plan you'll want to do it in advance before your 65th birthday. If you are not receiving Social Security when you turn 65, again, you're going to want to enroll through the Social Security website. And there are three main enrollment periods. First is initial enrollment. So if you're not covered by a group plan before age 65, special enrollment. So maybe you're still working and your employer does have 20 more employees. Well, you would be specially enrolled, and you're going to want to sign up after you're 65, but within 3 months of you planning to retire. And then there's the general enrollment period, which is considered any time after your 65th birthday and you're not in the special enrollment. Now, when does your coverage start? So it starts the month you turn 65 if you rolled in advance. Now, there used to be some really wonky schedules out there where you might have to wait 3, sometimes 6 months until coverage would start. They fixed some of these hiccups. Now you just have to wait until the next month. But if your coverage has ended from your employer or your COBRA has ended, there might be a gap of coverage. So making sure and applying before 65, and I joke with Matt about this frequently, in my Google calendars on my 64th birthday and 9 months, so 3 months before I turn 65, I have a reminder in my calendar that I need to sign up for Medicare, and I think everybody ultimately should. Because again, there'd be a gap of coverage and potentially a cost. Now, who signs up for Part A during the initial enrollment period? Pretty much, again, everybody who's over age 65, and unless those that work for an employer with less than 20 employees. Who signs up for Part B during the initial enrollment period? Again, a lot of the same folks. Um, the things that you'll want to be thinking about is, are you currently not working or self-employed or on COBRA or receiving health retiree benefits? These are the people that, again, should be signing up for Medicare Part B before they turn 65. Really, repeats for Part D as well. You really want to sign up before you turn 65 up to 3 months. But then comes in line with the special enrollment. So what we're going to be talking about with special enrollment, this is for people who were covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. And the way you'll have no gaps in coverage, but you actually have a grace period of several months to avoid late enrollment penalties. And for Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. So why risk it? Just go ahead and sign up as soon as you know that you're going to be retiring. So to summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. And while it's less than ideal, having 1 or 2 months of overlapping insurance payments versus the potential of thousands of dollars of expenses not being covered is definitely worth it. So again, sign up in advance. Now, what if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, again, there was this really strange period of time where there would be a lengthy penalty time where you could sign up in January where you might have had to wait until June for coverage to start. They have fixed a lot of these loopholes and pitfalls, if you will. And so now if you sign up and you missed all the general enrollment periods, you can sign up in January, February, and March, but the coverage is going to start the month after you sign up. So let's do a quick review of medical enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is 3 months before your 65th birthday, and Medicare coverage will start on the first month you turn 65. The special enrollment period is for everyone over 65 who is covered as a current worker or spouse of a current worker under an employer group that covers 20 or more employees. The best time to enroll in Medicare is before the coverage ends. So again, a few months before you retire. And the general enrollment period is for people who did not attend this presentation and didn't know they needed to sign up for Medicare in advance, but they can do that between January 1 and March 31st of each year with coverage starting the month after they enroll. So how do you sign up for parts A and B? Easy. Call 1-800-772-1213, which is the Social Security office. If not, you can also go to the Social Security website and follow the links to apply for Medicare. Also, we have resources where we can help guide you and help you sign up for all these as well. Now, Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug policy or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. And once you decided on original Medicare versus Medicare Advantage, and then chosen a specific plan, you can then enroll in Part D through the insurance company or through Medicare. And this brings us to part two, Medicare and private insurance. Focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into two main categories, premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and the private insurance companies offering the drug plans and Medigap policies or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of the doctor bills not paid by Medicare, and the services not covered by Medicare. So let's first look at the monthly premiums. Part A is free if you or your spouse has paid into Medicare over 10 years. This is one reason why most people sign up for Part A is when they turn 65, even if they're covered by an employer group plan, it doesn't cost anything. Now, Part B is different. It costs $174 a month in 2024, and the Part B premium is adjusted for inflation. So it might be higher next year and years to come. Also, higher income beneficiaries will pay more, which is through the IRMA tax, which we'll be talking about in a second. Now, Part D, again, varies depending on which plan you choose, but also based off of the total amount of coverage you ultimately want to have. Now, this chart is really very important. This is what's going to illustrate what you're going to be paying in your Medicare costs. Now, everybody gets the same quality of Medicare. You don't get to cut in front of lines. You don't get the best rated doctors if you pay more. No matter what you're paying, everybody's going to have the same Medicare. Now, what I want you to be thinking about is, what is your adjusted gross income, or rather your modified adjusted gross income, going to be this year, next year, or beyond? Because while you might be living a $150,000 a year lifestyle or a $350,000 a year lifestyle, depending on how taxable those dollars are, is what's going to determine how much your Medicare is going to be. Let me get my pen out. So modified gross income, married filing jointly, that's this column right here. Let's say a household was making $260,000. So they are right here. Well, they're going to pay the $174 for the baseline Part A. But what they're going to see is that there's going to be an increase of IRMA where it's going to effectively double their cost for Part B. And while Part D, if they were in the lowest bracket, they wouldn't pay anything, increases as well. So per person, what would have been $174 a month is now $382. Now let's go one step further. This is if they're filing jointly. What happens if one of the partners pass away? Well, and they make the same $260,000 a year. Now they're in this column. And they still pay those same $174, but their surcharge to IRMA has more than doubled. And now, as an individual, they're paying $633 a month for, again, the same Medicare that everybody else has, strictly because, one, they have taxable income, but then two, they also lost a spouse. So by now being single, the amount of cost going out the door for your Medicare coverage can get really expensive. And ask yourself, if you haven't measured this, if you haven't looked into what these numbers are going to be for you 5 years from now, 10 years from now, 15 years from now, especially once you start reaching RMD age, are you comfortable paying an extra, what is that, $500 a month, so an extra $6,000 a year going out the door for your baseline coverage? I'm not sure. I'm not sure you are. I'm personally speaking for myself, not ultimately comfortable with it. So let's build a plan around it. Okay, let me get back to this. Now, the deductible showing on the screen is for Part A is what's out of pocket per illness. Now, if you have some private insurance, they very well can cover some of these expenses. We'll discuss that in a moment. Part B deductible is a reasonable $240 per year, and this is waived for some preventative services such as flu shots and basic screenings. And the Part D deductible is $545 per year under the standard Medicare design. But Part D coverage is quite complicated, as we'll see in just a moment. Now, after you've met your deductibles, there are some other costs that Medicare doesn't pay your entire medical bill. For example, if your hospital stay exceeds 60 days, you'll be responsible for $400 per day up to the 90th day, and then $816 per day up to the 150th day. After that, you're paying the full cost. Medicare pays the full cost of 20 days of skilled nursing care. After that, you pay $204 per day for days 21 through 100. If you need more than 100 days of skilled nursing care, you're paying the full cost. And as for Part B, your responsibility is 20% of the Medicare approved cost. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 50% of the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest. The 20% plus the 15 over. Under the standard drug plan design, the beneficiary pays a $545 deductible, then 25% of drug costs after that deductible has been paid. And then there's a small copayment once out-of-pocket spending has reached $8,000. But drug plans vary widely. Some will pay more, requiring you to pay less, and it'll be important to find the right plan that covers the drugs that you take. And after looking at all these out-of-pocket expenses that you have to pay, you might be wondering, so what Medicare does cover? Well, it covers the first 60 days of hospitalization, minus the deductible, of course, and it covers 80% of your doctor's bills, and it covers some of your preventative services. Now, ultimately, one of the best reference guide is that Medicare New Book, and to get that, you can call 1-800-663-4227, or you can go to medicare.gov. Now, the Medicare New Booklet spends over 20 pages talking about what Medicare covers and only one page talking about what it doesn't cover. And I'm not talking about partial payments. I'm talking about zero coverage whatsoever. For the listed services you see here, now, some of these things you can avoid. Cosmetic surgery is optional, but in some incidences and accidents, particularly burns, it still might qualify as cosmetic surgery, might not be covered. Now, but think about your dental work, eyeglasses, hearing aids. There's a very large chance that over the 20, 30 years of retirement, you might need this, of which Medicare doesn't cover. And this is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of what the doctor bills aren't paying. And of course, that prescription drug coverage that isn't offered through Medicare. You can have private insurance fill that in. And ultimately, each plan has its own list of drugs called a formulary. And knowing what those costs for each of those drugs are, making sure that you're covered and making sure you don't get caught in a blind spot. Now, Medicare supplement insurance, commonly called Medigap policies, are issued by private insurance companies, and they're designed to fill in the gaps that Medicare doesn't cover. Although they are not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. This is really important to look at your Medigap coverage, especially for those of you that travel a lot intrastate, but also travel internationally, because some of those Medigap policies have some international coverages as well. Now, Medigap insurance policies are standardized and they're identified by the letters A through N. So if you buy a Plan G in California, it'll offer the same benefits as Plan G in New York. However, the premiums can vary considerably from company to company and from zip code to zip code. That's why it's important for you to carefully evaluate your Medigap insurance and not pay too much for it. Again, we don't really have the time to go into depth, but we can connect you with a professional that can do exactly that. Now, Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract through Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. Now, you may have to use the network's doctors or hospitals, and you'll want a plan that includes prescription drug coverage. You may even be able to get benefits like vision care. But the benefits and cost sharing of Medicare Advantage plans are different than that of original Medicare. So again, you'll want to shop carefully and choose a plan that fits your needs and lifestyle. And this is just a reminder to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering that policy at the lowest price. And before signing up, check to make sure your provider's billing department to make sure that they process the billing for the company you choose. Otherwise, you'll have to pay the bills yourself and then file a claim. So just ultimately make sure the plan's in place that you're looking for. As a wrap up, we're going to talk briefly about overall healthcare costs. We do not want to get into the weeds here, but to make sure you have a realistic understanding of the challenges of building a retirement healthcare budget, we have to go over some basics. What can cause your healthcare budget to change? Two things: inflation and the risk of getting sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get even more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much that you find yourself in the donut hole, having to pay thousands of dollars a year for your medications. And there's always the possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. How can you plan for rising healthcare costs when you might be on a fixed income when you retire? One way is to set aside enough funds to cover your future healthcare costs. Right now, a ton of studies are showing anywhere that we need between $150 upwards to $300,000 for a household. But these are just the averages, which means some households are substantially more. And yes, households are also substantially less. But you're here for a reason. You're watching, you've made it this far to the presentation for a reason. It's because you're a planner. You want to be prepared. You want to know how this all fits in. And so making sure that your medical expenses are a part of your plan are one of the first steps. Now, how many of you know someone who got old and needed long-term care? Now, we're not talking necessarily about nursing care, but long-term care can range from someone coming to the home a few hours a week to help with meal preparation to skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. And when most households need some kind of long-term care assistance, the statistics show that we're closer between 28 to 36 months, depending on your gender and the ailment that you're dealing with. So how much does long-term care cost? Well, it varies. Depends on where you're at and the services you're needing. Anywhere between $163 per day up. Adult daycare costs about $78 per day on average, but it can range from $30 to $160. And residents in assisted living can range from $3,000 to $7,000 per month, depending on the location and amenities. And the median monthly rate is about $4,500. The most expensive type of care, of course, is a nursing home, where residents can get skilled nursing care. A private room can range from $200 per day up to $1,200 per day. And the median daily rate is about $300. 1 year at this rate, you can easily be spending over $100,000. Now, none of us think about getting old in needing long-term care, but there are some very compelling reasons why we need it. Right now, 70% of Americans that are over the age of 60 are going to be needing some kind of long-term care assistance. Have we built that into your plan? Now, one common fallacy is, well, do I need to cover that full $5,000 a month? No, you don't, because one, you're not covering, you might not be living in your home anymore. So some of those expenses might be going away. Two, your travel budget has likely decreased as well. So we can allocate the money we plan for your travel to cover these expenses. At the end of the day, we're just going to want to have that plan. And so there's a lot more to say about planning for long-term care, but our time's nearly up. So I will leave you with 3 key reminders that relate back to our key points. First is please just make sure you enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or you can wait until you retire from your covered employer and enroll when you need to avoid the penalties and coverage gaps. Two, shop carefully for private insurance to go with your Medicare. Evaluate all your options and choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage that you need at a price you can afford. Don't be one of those people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare costs will be higher than they are today. And so when you're planning for your retirement and figuring out how much savings you're going to need, be sure to factor in an extra amount for healthcare. You'll be very glad you did. Thank you so much for your time, your energy. Nothing's more valuable than that. Be on the lookout for our next workshop, taking a deep dive explicitly onto long-term care, followed up by estate planning and taxes. Thank you so much, and talk to you soon.